once again. This is Guardia Di Medicina. It's so good to see you guys back again.
Feels great, man. Feels like forever since I talked to you.
I know, right? I know today we're talking about different vitamins. We're focusing in on vitamin D. We're focusing in on fiber. We're going to talk about a lot of really, really cool stuff that I didn't even know about. Like I mentioned before, they do not teach these things in medical school. I want to emphasize that. They do not teach these things in medical school. So this was us doing our own research, and the data is very, very good on all these things.
It's pretty eye-opening. And when it comes to vitamins and supplements, I will be honest with you, there's a lot of garbage out there. There's a lot of stuff that I wouldn't recommend, and there's a lot of stuff on the shelf that I don't even think should be on the shelf. And we'll talk about a little bit of that stuff too. But there, like you said, there are some really important things that we kind of, in my opinion, glazed over in school and didn't touch it nearly as deep as we should have.
And to be fair, we are covering a lot. But once again, I go back to the Flexner report, and we covered that in episode 3, where the birth of the medical industrial complex, they chose what they wanted to teach. We did not choose health prevention based off of appropriate nutrition, based off of appropriate vitamins. We went straight through very linear type education. Hey, we got symptom X, we got symptom Y, we got symptom Z. They have a certain disease that's treated by medication, A. And that was pretty much how we learned. We did not learn how these different vitamin supplements cover and go across multiple different systems throughout the body and affect and upregulate multiple different things that affect multiple different systems. So I'm very excited. Which one do you want to talk about first?
Well, even before we get into that, since we talk a lot about, big money and corruption, who's behind what, I just wanted to kind of go over a little bit of the financials of this industry, because I do think it's important. We live in a capitalistic society. So in 2024, the U.S. dietary supplement market reached $69.3 billion. So just in 1 year, almost $70 billion. Now, vitamins accounted for about 38% of that number. So it's pretty big money as an industry. So when you walk into a GNC, if they still have those, I honestly don't know, or any aisle in a store pharmacy that has the vitamins, it can be a little bit overwhelming to figure out what you should purchase. Even if I want calcium, there's what brand of calcium, how much calcium with vitamin D, what should I get? It's very overwhelming, and ideally you could ask the pharmacist, and some of you go to pharmacies, that maybe is a possibility, but a lot of pharmacists don't have really the time anymore, unfortunately, to do that part of the job because they are overwhelmed with corporate metrics and filling prescriptions. But so unfortunately, the supplement market is kind of the Wild West, and it's totally unregulated. I think you might know this as well. But not only in regards to safety data, but also like good manufacturing practices.
And that's really sad, by the way, because what we're going to talk about is these are the safest things for you if they're used appropriately, right, and you're getting the right thing. Different vitamins that are made appropriately, studied appropriately, packaged appropriately, would be approved by the same people that approve for our medications, the FDA. We've covered how the FDA may not be on the up and up as we were hopeful for, but it's sad that it's the wild, wild west and it's viewed that way, because these are the things that should be the safest for people and would be the best thing to treat certain things if we can figure out that they do treat certain things. We should have randomized control studies on all of these different supplements. And the reason why I feel that way is because a lot of the medications, let's say if I prescribe Lexapro, you look over the side effects, there's like 20 different side effects.
Right. But the thing, though, with all the safety data, I'm totally with you, but the supplement industry isn't even regulated for how they manufacture the stuff. And what I mean by that is are the facilities free of contamination and clean? Does this even contain the ingredient that the label says it does? Now, believe it or not, that happens way more often than you'd like. You go to pick up a vitamin or supplement and you're going to get ginkgo biloba, and you buy it and you go home and you take it. If it's not made in a facility that certifies that they practice good manufacturing practices, there might not even be ginkgo in there. There might be other things in there. Nobody checks that. So how do we avoid this? As a medical professional, how do I direct people to the right ones? Well, certain brands will carry what's called USP certification. It's a gold stamp. It'll say USP certified. What that means is they manufacture their supplements, vitamins, whatever they're selling, up to the standard of prescription drugs. So they go through a rigorous process to prove what's on the labels in the bottle, that the way they manufacture it's clean, free of contamination. So I will always recommend products with that USP certification because at the very least, now I know this is vitamin D. I know this is ginkgo biloba. I know whatever it is, what's on the label is on the bottle. And not every company does that. If you're wondering what companies do, Nature Made is one. They don't sponsor us. Most of their stuff is USP certified, but I will say not all of their supplements and vitamins are USP certified. So look for that stamp, USP certification. That's the most important thing if you're buying a product over the counter.
That's interesting. I want to bring that up because there have been certain articles that I've read, and I can't recall specific names off the top of my head, but there is a concern that these manufacturing companies, both for vitamins as well as regular prescription drug medications, are taking their facilities out of the United States so that way they cannot be evaluated by the appropriate regulatory systems for cleanliness, for sterilization, for appropriate ingredients, for rat manifestations, things that I've heard, crazy things. So super, super important. I just want to interject that.
And there are like generic medications that are made overseas and like in different countries, and they do still follow these same processes. So even if somebody were to take a company overseas to try to dodge this, they don't get that USP certification unless they go through all this rigorous. And not only do they have to prove like, you know, what's on the labels in the bottle, they do random batch testing. So they'll have somebody come in and say, give me that bottle, and they'll test what's in, and they'll make sure that it matches what's on the label.
Are prescription medications USP certified?
Yes. All if you make generic or brand drugs, you have to prove USP certification. You have to go through this process.
Sure.
This is just some of these companies that make supplements do it because this is an ongoing issue that, again, not a lot of people even, you don't think about this. You go buy some calcium and vitamin D, you're not thinking, is this really calcium? Is there some other stuff in this? Because why would you? But really, it's the reality of the situation that nobody's regulating that market. And unless you independently get that USP certification stamp, it's, in my opinion, not worth anything.
100%. I couldn't agree more with that.
And so another thing that they test with USP certification is not only the manufacturing, but will it break down in the body? So if you take a supplement, will this actually dissolve and be absorbed? Will you not just excrete the whole tablet by itself? Other companies that don't have USP certification don't do that testing either. So, as you know, it is regulated by the FDA, but I think at the very least, this stamp comes along with, hey, this is done the right way. As far as the data behind what you're taking, we can have those conversations, you know, independently of this. But as long as I know this is made in the right facility the right way, then we can at least start there.
Absolutely. Anyway, the fact that we could have trust, at least we assume that we have trust that, hey, I want you to go buy B12, USP certified. We know that we're for sure getting B12. Now, that has nothing to do with, hey, your gut microbiome is going to absorb this medication appropriately. It's going to have the appropriate metabolite breakdown. It's going to get to those certain places that we want it to get to. But at least we can start off with the right spot with, hey, these are the ingredients we know that we are getting.
Right.
Eliminate that variable.
And it's a variable that we shouldn't really even
have to think about.
You shouldn't have to worry about that.
Absolutely
at this
not.
point.
That's insane.
At
It's
this point,
2025.
Yeah, you should be able to pick up something on the counter and what's in the bottle's on the label, and if it's not, then that company should get in some shit.
Mm-hmm.
That's really what it comes down to, and it's crazy that we're at this point, and that's not really how it works in all the cases.
Mm-hmm.
So, you know, do these supplements work? You know, it comes down to essentially the easy answer is if you are deficient in something, supplementing what you're deficient in can make a big difference. Obviously, you need calcium as you get older, for example. We all kind of know calcium makes strong bones. So if you're deficient in calcium, it can lead to brittle bones, osteoporosis, which can lead to fractures and obviously worse health outcomes. You know, if somebody is elderly and breaks their hip, they have basically that's a recipe for disaster in healthcare terms.
And just to throw a stat at you, 50% of patients over the age of 80 that have a hip fracture have a 1-year mortality rate, which is insane. And you're thinking, well, how could that be? Well, if you're over the age of 80, you have osteoporosis, and you break a hip, you have to have major surgery. Well, then you are in the hospital, then you have to go to rehab. You can have risk of postoperative infection. You can have risk of postoperative delirium. You can have physical deconditioning. So super, super important to maintain your bone health throughout your life, especially for your postmenopausal females.
Absolutely. And that's just one tiny piece of this whole supplementation puzzle. So, I mean, when we talk about vitamins, there's two main categories of vitamins. You have your water-soluble vitamins and your fat-soluble vitamins. And what that means is water-soluble vitamins, to make it easy, those are the ones that your body pees out the rest of them if you have extra of them. We don't really worry about getting too much vitamin C, too many B vitamins in most cases. Now, there are some examples where that might not be the case. But in general, you can think of the water-soluble vitamins, the ones that don't stick around in the body. That's why if you buy like energy drinks, you might see something have 1,000% the B vitamins you need in the day. That's because your body's going to shoot out the rest of them. Now, the fat-soluble vitamins are vitamins A, D, E, and K. Those are the ones that stick around. Those are the ones that you can get too much of, and you can have bad outcomes from getting too much of those. But because they're fat soluble, sometimes we can dose them a little bit differently. That's why some people are on vitamin D they take once a month. It's a fat soluble vitamin. You can get a blast of that, and that sticks around for a while. So that's possible. It's not possible with the water soluble vitamins, obviously. So I'm not going to be the person that's going to sell you a pill rather than telling you to get this stuff through your diet. I think it's pretty clear through the research, and it kind of makes sense that the way our bodies run best is if we get all of our vitamins and minerals through what we're eating. Now, that's not always possible. So, I mean, I like the phrase, don't let perfect be the enemy of good. So if you are deficient in something, you really try to eat healthy, but you might need a little bit extra vitamin D, whatever. Just supplement. It's okay. Don't stress out over it. Don't let perfect be the enemy of good. I don't know how you feel about that.
I perfectly agree. The only thing I would interject is the reason why we're in this position is because how unhealthy our food is.
Yes.
We're in this position because the US FDA has let us down tremendously with the amount of food additives in ultra-processed food and the way our food is delivered to us in the United States. But now that we're here, we're going to try to give you some tips that may be very beneficial for you.
Absolutely. And one of the vitamins that we really want to highlight, we talked about it earlier, is vitamin D. Vitamin D is extremely important for so many different things, and we're really kind of learning it's important for things that you might not have even thought about in the first place. So the basic guidelines from the American Endocrine Society, I can't remember their official title, but they report that about 24% of U.S. adults are deficient in vitamin D, just total. The highest rates of that deficiency occur in the northern states, and particularly during wintertime. And the reason of that is because you can also get vitamin D from the sun. I know that you can talk about a lot of the differences between oral and absorbed vitamin D, topical absorbed.
Yeah, and just to go over this, what happens is that you take vitamin D, that gets absorbed from the intestines into the bloodstream, and then the liver converts that into its active form that goes into the bloodstream. It's called 25-hydroxy vitamin D. And then you can get the next form that is used in specific tissues, like in the bones and so on and so forth, which is 1,25-dihydroxy vitamin D. And you get that two different ways. You get that by an enzyme called 1-alpha-hydroxylase or by UV light from the skin. So really, really important if you get UV light, sunshine, that you can get the actual form of vitamin D that is used in your bones or in the organs that are needed, and also your brain, which, by the way, we're going to get to in a little bit.
And so, like we said before, the highest rates of vitamin D deficiency in the U.S. are in the northern states, especially during wintertime, which kind of makes sense. That's when we don't get as much sunlight. You're not outside as often, and there's really, the day is shorter. There's more darkness.
And it could be why we develop cabin fever.
Absolutely. I'm sure it has something to do with it. So they defined severe deficiency, from what I've seen, as far as an objective lab value is less than 30 nanograms per liter of vitamin D. Now, you can get a blood test for vitamin D. That can be included in your labs. Am I correct?
It absolutely can be. I just want to, because sometimes the units are a little bit different. Less than 30 is, on certain metrics, just regular deficiency.
Okay.
Severe deficiency is less than 10.
Okay.
When you have severe deficiency, that's when you start getting worried about things like rickets if you're a child, and that's when you start getting worried, hey, am I even absorbing any of my fat-soluble vitamins, such as celiac disease? Celiac disease is a disease that affects the intestines, that prohibits certain factors from being absorbed appropriately. There can be other GI conditions that are similar in presenting to that. So when you have anything less than 10, that's when you ask yourself, hey, do I have something going on that's preventing me from even absorbing a small amount from even in my food?
That makes sense. But the research that I did, the under 30 nanomoles per liter is linked to not only osteoporosis, but also increased risks of fractures, heart disease, and diabetes.
Absolutely.
So this is one of those things that if you're deficient in vitamin, you might not even know. You might just feel worse during the winter months. And like you said, think, oh, this is cabin fever. When in reality, you're deficient in vitamin D for half the year because you're not even thinking about it.
Yeah, and it is concerning because of all the things that you just said. And especially if somebody is reliant on their immune system to fight respiratory infections, if they're vitamin D deficient and it's negatively impacting their immune system, and they catch RSV or they catch the flu, they may be at higher risk of ending up in the hospital because of this too.
Absolutely. And I do want to point out, though, like I said earlier, you only need vitamin D if you are deficient. So sometimes I think it's easy to go, I really want to take a supplement or something to help me feel better. I'm going to go buy something that looks like it's going to work. And I can feel for that. But taking too much vitamin D can be a problem. And if you are not deficient, taking extra vitamin D will not do anything for you.
I'm not going to bore everybody with the physiology of this, but vitamin D leads to increased calcium. It can certainly lead to different types of kidney stones. It can also affect your neurologic system. It can cause confusion, tiredness, muscle weakness. It can also affect the heart. It can cause certain arrhythmias. It can cause different changes on your EKG. And so you always have to be very careful and always make sure that you have a blood test that is showing that you're vitamin D deficient before you start taking a vitamin D supplement, because we don't want you to run into any specific kind of trouble with this.
Absolutely. And I think it's important, talk to your physician before you take any supplement or vitamin. That's not just vitamin D. It's always an important conversation to have, at least with your pharmacist, but definitely with your physician. We talked earlier that getting it through your diet and day-to-day life is better than getting it as a supplement. So how do we get vitamin D? What's the easiest way? Well, the easiest and the cheapest way is sunlight. We talked about that before. They do say if you get about 20 minutes a day of sunlight just for 3 or 4 days a week, that should be enough vitamin D for you to absorb that way. If you want to get it through your diet, vitamin D-rich foods are like fish and eggs. They recommend to get between 600 and 800 units daily. But people who are at risk of a deficiency, like those of us that live in the northern states of the U.S., you want to shoot for between 800 to 1,000 units of vitamin D a day. And again, like you said, you can get blood work to see what your baseline vitamin D level is at and kind of go from there. The water-soluble vitamins are also very important. Vitamin C is one of the first ones that we think of. 1 to 2 grams per day of vitamin C has actually shown to reduce this, not only the duration, but the severity of cold symptoms, especially in children and those under physical stress. So those are high-risk individuals, and a lot of times common cold and respiratory illnesses can turn into other worse things. So again, vitamin C supplementation can reduce both the duration and the severity. And in addition to that, if you combine vitamin C and zinc, you can reduce respiratory infections by about 33%. So you can shorten them. But you do have to take both the zinc and the vitamin C within 24 hours of developing symptoms really to see any sort of a benefit.
And I do find that fascinating because those are the exact supplements that we recommended in the beginning parts of COVID when we really didn't know how to treat COVID, because we were doing everything we can to boost the immune system, try to fight off this virus that we didn't really know what was doing to the body. I find that very fascinating. One of the pathophysiology things about that is we found that COVID causes more inflammation than the standard virus. And anytime you have this chronic or acute inflammation, it affects the way that our immune system is regulated. So these vitamins are ultra important at downregulating some of those different cytokines. As we'll see, if you look at the studies, you'll see that specifically vitamin D and then also vitamin C and zinc, they downregulate the inflammatory cytokines, which are essentially the chemicals that cause the immune system to either promote inflammation or get rid of inflammation.
Which is, very, very interesting. And, in summary in all this, I think that when it comes to vitamins, it's important, it sounds kind of ridiculous, but it's important to just supplement what you don't have. There's a lot of extra stuff out there. It's hard to pick a product, but like we said before, make sure to get one that's USP certified. Now, I do want to talk some more about vitamin D with you because we just kind of touched on the surface of the importance there, and we kind of bounced the water soluble vitamins. But vitamin D has a lot of interesting data out there for some other things, and I know you wanted to talk about that.
And I wanted to talk specifically about depression. But before I get into the data for vitamin D with depression, I first want to talk about one of the biggest lies in U.S. healthcare history. We've talked about several of the biggest lies in U.S. healthcare history, but this is a big one. Back in 1987, the SSRIs, the first one came out, Prozac. And the reason why there was this push from the psychiatry team to get this medication out there is because the TCAs, tricyclic antidepressants, and monoamine oxidase inhibitors had significant side effects, and they just really weren't working. And SSRI stands for selective serotonin reuptake inhibitor, essentially a fancy way of saying we're going to increase your serotonin levels. We'll get into what serotonin is, but essentially it's a chemical called a neurotransmitter that literally links the different signals between the two different cells in the neurologic system. So if you're deficient in this chemical, then your cells maybe aren't communicating with one another. That was the story that was sold to the American people, is that all depression is a serotonin deficiency. We now know that that is a complete lie. We've known that that's a lie for some time. We still are somewhat taught this in medical school. I was never taught in medical school the different things that are involved in the pathway with depression, and that's just one of them. It's not just a single neurotransmitter imbalance, but it's a system-level disorder. It involves, of course, neurotransmitters. It involves body inflammation that also goes across the blood-brain barrier. It also involves endocrine signals. It involves the circadian rhythm. It involves the immune regulation. And vitamin D works across all these domains. There are different chemicals that work across all different domains that are mainly supplements, and vitamin D is one of them. Essentially, what happens if you have low vitamin D, your neurons have a decreased ability to adapt because of that impaired neuroplasticity. Neuroplasticity means essentially the neuron, which is the cell inside the neurologic system's ability to upregulate or downregulate different receptors and interact with those different neurotransmitters. Plus, low vitamin D increases neurologic inflammation, which then alters the different neurotransmitters in terms of their ability to send signals to different types of neurons. It also affects the HPA axis, which stands for hypothalamus pituitary adrenal gland. Essentially, this is your stress axis, the one that releases cortisol. So, of course, if it interacts with that pathway, it could potentially lead to more cortisol simply because there's low vitamin D, which can lead to increased stress and anxiety and depression.
So low vitamin D is causing a cascade of events in the body that can all affect each other and snowball into a lot of
100%.
bad outcomes.
100%. And just to dive in a little bit more specifically into the anatomy, the vitamin D receptors are found in the prefrontal cortex, the hippocampus, the amygdala, the hypothalamus. All these things, all these regions in the brain are hugely important for our mental health. And if we simply have enough vitamin D, there's a chance that these different neurons that are in all these different areas of the brain will be able to adapt when certain different chemical compositions arise from the neurotransmitters.
And so I want people to understand that we're not saying this is a miracle, take vitamin D supplement. I think we've been pretty clear to supplement if you are deficient. However, 1 out of every 4 adults in the U.S. are deficient, and it's more prevalent in the northern states, which is where we live. So that's easy to say that it's more than 1 out of 4 people are deficient. And if you can help that many people simply by increasing their vitamin D, I mean, it's a no-brainer.
It is clearly a no-brainer because it's much more safe. It's much more safe than the SSRIs, which if you look up the different amount of side effects, you're going to run into 15 or 20 of them. One of them is a black box warning, which is it can increase your risk of suicidal thoughts within the first 2 weeks of taking it. And the reason why it's a black box warning is because it has to be put on there. The FDA has forced those manufacturing companies to put that on the label to keep patients aware and keep them safe. Now, we mentioned that there's a big giant cascade that vitamin D affects. It affects chronic body inflammation. It affects also the immune system, which we didn't quite get into. It affects that HPA axis. SSRIs only affect one small part of this pathway. It only affects that neurotransmitter inside of the different neurons. Neurons, remember, the different cells inside the nervous system, and that small little communication. It affects that one small spot when vitamin D affects the entire body. And that's why I think it's so disheartening when we are told that simply depression is a serotonin deficiency. Yes, certainly neurotransmitter abnormalities is a part of it, but chronic body inflammation is a part of it, and many other different pathways, such as the endocrine pathway with, how much cortisol releasing is a part of it. We are downplaying and we're not giving our patients the appropriate chance to try to recover from their mental health if we keep just saying, take this one pill and everything's going to be better.
For sure, but SSRIs do help out. They help a lot of people. They're an important medication to be around, and there are a lot of people that need them regardless of vitamin D status. And I don't want that to get lost in all this. I just really want to highlight how many people can be helped with a little tweak just like this.
Absolutely. I couldn't agree more. And also, I do agree that, I'm on an SSRI. I've recovered from depression and anxiety. It has helped me out tremendously. The reason why I'm bringing this up is because if you ask the average person what is depression, they're going to tell you a chemical imbalance. Mm-hmm. And that's just so grossly inaccurate. It goes from the actual neurotransmitter imbalance to the inflammation in the nervous system to that HPA access to genetic factors to different metabolic disturbances and to different social and existential stressors. It's all that giant pathway, and vitamin D helps out with the majority of those things, and it's much more safe than an SSRI. Majority of patients, I don't want to say majority, that's overstating it, but a lot of patients can't even get off their SSRI.
Well, and you know what vitamin D doesn't come with is side effects, especially when you get it naturally. I mean, if you're baking in the sun too long, yeah, you're going to get a sunburn. But if you get vitamin D the adequate amount through your diet and you're out in the sun for 20 minutes a day, there aren't side effects that come with taking vitamin D that way.
It's so true. It's so true. And I fear that this tunnel vision of treatment of depression with just the SSRIs is because of the same system that we talked about before, that it's for profit, it's easy to explain, it's easy to market, and there's already a system behind it. We're going to keep selling these patients these medications, in particular because they have trouble getting off of them. Mm-hmm. So they have to stay on it for close to the rest of their lives. And they're trying to tell you that all you need is this slight adjustment in your chemical receptors, but that's not true. You need adjustments to your whole body, essentially. It's very complex. It's multi-system. It involves the mind, body, and a clear, disorder that encompasses multiple different pathways. And I feel bad that the mainstream treatment just focuses on that one chemical component of it. I think that's doing our patients a huge disservice.
For sure. And I think that people are frustrated in general too, because there's, like we talked about before, there's a lot of distrust in medicine now, and there's a lot of people that don't trust physicians. They don't trust their pharmacists. They do their own research, and I applaud doing your own research, but you also need to understand what you don't understand, I guess. But I think that a lot of that mistrust has come, people are depressed and they're looking other ways, and a lot of people look for natural products on the shelf as well.
That is true.
And believe it or not, I'm not anti-natural product. I'll tell you, there's a lot of, like I said before, there's garbage out there. But I'm not going to be the pharmacist that tells you that none of these natural products do anything. Now, they can also be expensive, and they can interact with some of your medications. So you have to be careful what you're taking. It's not just, I'm going to try this one out and see how I feel. If you're on a half a dozen medications, you need to run that by your physician and your pharmacist to make sure that's okay.
You absolutely do. And to be honest, I get asked these questions a lot. Hey, doc, does this supplement get interfere with my medications? I'm going to be straight up with everybody. We don't know.
Yeah. There's some of them that are more egregious than others, but I think that people are desperate to treat. A lot of people don't want to go on an SSRI because they've been on one before, or they know the side effects, or there's just a stigma with them, so they try to self-treat using natural products. And not only just with depression. There's other things people use natural products for, but if you want to talk about some of the ones that I like, the first one is ginger. Ginger comes, I mean, obviously you think about it in your diet, but there are ginger capsules, there are ginger chews. It's safe to use in pregnancy. It's been effective in pregnancy and reducing nausea. So when it comes to, obviously you want to be careful what you put in your body anytime, but on a pregnant woman, when there's also a baby growing in there, you need to be extra careful. And ginkgo has been proven to be safe and effective. And it also has even shown some data in pain relief in osteoarthritis. In addition to that, even glycemic control. Like ginger is one of those products that is legit, and we should include it in our diet even more than we do. I would rather include ginger in what I'm making than take a ginger capsule. Now, obviously, it can cause some kind of heartburn and that kind of stuff. That's the side effects of taking ginger. But that is a natural product that I would recommend that is safe and effective. I'm not a fan of stuff like St. John's wort. We talk about depression. That's one of the first things people go to as far as a natural product. It interacts with everything. That's like in pharmacy school, you ask any first-year pharmacy student, you get a med list and St. John's wort is on that med list, you're going to take that off right away because that interacts with everything you could ever imagine. But you need to know that because it's one of the more common things that people take as far as natural products. I'm sure people have asked you about St. John's wort.
They have. In your experience, what do people even take St. John's wort for traditionally?
Just depression. That's
Sure.
the main one is depression and anxiety.
Sure.
Now, saw palmetto, people use to take to alleviate symptoms of BPH, and for those not medical professionals, that's an enlarged prostate. Saw palmetto does have some efficacy to help with that. So again, if you want to try a natural route, I'm not against saw palmetto, but you have to look out for drug interactions. But what I really want to talk about as far as natural products is dietary fiber. That's one thing that I think that really as a whole in healthcare that we don't focus enough on. It's something that we breezed over in pharmacy school. We learned Metamucil as psyllium husk, which is fiber, and really that's about it. We learned how it worked, and we moved right on. We did not learn all the ins and outs of how important fiber is to your day-to-day life and your diet.
I definitely didn't learn it in medical school either.
No, and I think that, if you're listening to this and you don't consciously think about your fiber intake, this is a step you can take that will dramatically improve the way you feel. It'll improve multiple parts of your life. And I know in fiber, people think of just what it does to your GI system. Fiber helps me poop. Yes, it does do that. That's one of the things that it does. It can also, if you have diarrhea, it can help the other way. It can help slow things down and regulate. So as far as just your GI system, on the very surface level, fiber is important. But it's so much more important for so many more things. I can't wait to talk about some of these. But right off the bat, one of them that I want to talk about is that it literally, eating enough fiber reduces your risk of colon cancer. And unfortunately, colon cancer has become, I don't want to say an epidemic because I think that that's maybe editorializing it a little bit, but in younger generations, it's starting to hit younger and younger people.
Yes, it is. Yes, it is. And I think it's because of the different types of food additives that we're putting in, and we're increasing the amount of chemicals that our colonocytes and our colonic bacteria are exposed to.
Yes, and like we talked about, like you said, the additives, microplastics, I don't even know all the things that can go into it, but the rates of colon cancer, colorectal cancer are going up in younger individuals. So taking fiber, eating fiber, literally reduces that risk. It reduces your risk so much that for every 10 grams of fiber you take in, you reduce your risk for colorectal cancer, all colon and rectal cancers, by 10%.
What a great stat.
Every 10 grams, it reduces it more and more. And that's independent of lifestyle, age, sex, anything. It's flat out eating enough fiber reduces your risk of colorectal cancer. And that's just a small thing that you can do in your day-to-day life. Now, I'm a fan of Metamucil when it comes to helping people get regular. If you need your bowel habits, if you need some help, Metamucil is great. It's psyllium husk. It's a natural product. It's fiber. Now, having said that, believe it or not, the guidelines do show that if you just supplement fiber and you don't take it in your diet, it doesn't have as good of outcomes when it comes to cancer. So if you're just taking 30 grams of Metamucil every day, it's not going to do the same thing as making sure you eat the right things.
Once again, I think that goes back to we would love for the United States FDA to provide us with healthy, nutritious food rather than the garbage that they
Right.
give us. But continue. I mean, obviously,
No.
that's not always possible. Go ahead.
Yeah.
I'm sorry.
No, that's so but flat out we're saying here that eating the right foods can literally reduce your rates of cancer. On top of that, there's a measure called hemoglobin A1C. It's what we use to, in layman's terms, to measure a diabetics or non-diabetics blood sugar, the average of 3 months, how it's been going. So fiber supplementation, or a high fiber intake, I apologize, can reduce your A1C by up to 0.63%. And I know that that's a kind of subjective number for those of us that aren't in the healthcare field. It's not a giant jump, but when you think about this is nothing. You don't even touch calories. All you're doing is affecting fiber intake, and you can reduce somebody's A1C by over 0.5%.
I've also seen studies where fiber supplementation decreases the carbohydrate absorption from the GI tract into the bloodstream. And for those of us that don't know, carbohydrates get broken down eventually into glucose. Not all of them. There's certain different types, of course. But then that decreases that glucose spike. And just to go off of a quick, just a quick story here, that glucose spike has been hypothesized to be the leading contributor to heart attack and stroke. The reason why I find this very interesting is because there was a big debate back when Lipitor and the different types of statins came out in regards to, well, is it really the cholesterol that's causing a heart attack and stroke, or is it really the glucose spike that's causing the heart attack and stroke? And it ended up being that, there's conspiracies on this, that the people that were in favor of Lipitor being promoted and marketed to the population, that those studies were not done appropriately, and there was certain money behind closed doors to essentially push for physicians to prescribe the cholesterol medications and focus more on cholesterol reduction before glucose reduction. So I'm bringing up that because glucose is so extremely important, and if you have certain spikes, even if your average is still appropriate, if you have high spikes, you are more likely to develop heart attack and stroke compared to the average population.
And I mean, it makes sense when you think about all this, when you think about the body as a whole. So how much fiber should people get? People at home, like, okay, now what do I do? Well, it kind of varies based on whether you're a man or a woman and based around your age. Guys should get about 40 grams of fiber a day, your average adult male. Men over 50, you can get by with a little less. 30 is okay. As far as women, you need only about 25 grams per day, but probably shoot closer to 30. And a women over 50 can get by with about 20 grams. Kids, depending on age, between 15 and 30 grams. To make it easy, though, rather than remembering all these different values, if you get about 35 grams of fiber a day, you're pretty covered. So how much does the average American actually take in? It's closer to 15 grams of fiber a day. So it's far below the recommended amount. So most people are deficient in their dietary fiber.
That's also a huge problem because remember, on average, like we talked about before, we're taking in 3,600 calories per day, compared to Europe, which is 2,400. So we're taking in more calories, probably carbohydrates, and we're taking in less fiber. That's way worse blood glucose control, and that's why we can see our diabetes rate shooting up and our obesity rate shooting up.
I'm glad you brought up calories too, because there's another part of this that I wanted to talk about. I think that as we get older, like, I'd love to drop a couple of pounds. I don't know anybody who wouldn't want to drop a couple of pounds. Now, believe it or not, it's been proven in randomized controlled trials that increasing dietary fiber leads to a reduction in body weight, BMI, and waist circumference, even without intentional calorie restriction.
That's fantastic.
So I'm going to say that again.
That's really cool.
That's literally, it's been proven that if you eat more fiber without watching your calories, it's been proven you'll lose weight, reduce waist circumference, and decrease your BMI.
The fact that I'm a family medicine physician and didn't know that is astounding to me. And trust me, I study a lot.
Yeah, and I mean, now don't get me wrong. It's not some massive, you're looking at about a pound over a few weeks.
Still, though.
Right, but those individuals who are more overweight and obese, they do see a more robust effect. But I will say, too, when you're on a calorie-restricted diet, those that are watching their calories, higher fiber intake does predict greater weight loss and better dietary adherence independent of macronutrient composition. So what that means is no matter how you break up fats, carbs, and protein, you can eat all fats, and probably not all fats, check that. But no matter how you break it, independent of how you compose your diet, if you're on a calorie restricted diet and you increase your fiber, you're going to lose weight faster and you're going to keep it off more than somebody who doesn't have enough fiber in their diet.
And I have a lot of patients come and say, hey, doc, I promise you I'm not eating a lot, but I am always hungry no matter what, even if I eat more or if I eat less. And even if I eat less, I'm always hungry and I can't lose weight. Think about doing this.
Yeah.
Because, you want, fiber obviously promotes colonic health and decreases the risk of constipation. But soluble fiber, like you're mentioning, in the stomach actually decreases that transit time to allow you to feel fuller for a longer period of time.
Absolutely. And the thing about high fiber intake, and I keep saying high fiber, really I just mean adequate because we don't eat enough in this country, but it doesn't only support weight loss, it supports weight maintenance. So a lot of people, power through a diet, drop 10 pounds, feel good about themselves, they slip into old habits, they put 15 pounds back on, and it's this vicious cycle of back and forth. And, I'm guilty of it. I know it's very hard. But if you constantly focus on eating enough fiber, you are more likely to maintain your weight. Literally. So that's why I think that a lot of times in diet, people focus on calorie restriction. Hey, I can't eat this. I can't have this. I can't drink this. And while it is important to understand your limits, if you focus on I have to eat 40 grams of fiber today, you're not going to have enough room to eat the other stuff that you really shouldn't be eating. So rather than focusing on cutting out sweets or cutting out this, focus on putting more things into your diet. And okay, I have to eat 40 grams of fiber. What's that look like? I have to eat this many serving of beans. Whatever fiber, carrots, whatever you like, find what you like, get your fiber, and then see how hungry you are at the end of the day.
I think that's also a great plan for if you're one of those patients that are currently on the GLP-1s. What I mean by that, I mean the Ozempic, Mounjaro, Zepbound, Wegovy. You're trying to come off of those medications because you've lost the weight and you're happy with your body and you're at a healthy weight. Maybe you would look into trying to focus on maintaining your appropriate fiber intake to try to hold off that weight.
Absolutely. And it's, you can't go through life saying, I'm never going to eat a slice of cake again because I'm going to gain weight. But if you go through life saying, I'm going to get 40 grams of fiber every day, and that slice of cake happens at a birthday party, it's no big deal. You're cool. You're fine. Your body's healthy. You're maintaining a good weight. You're dropping weight. This is the way that we stay healthy. This is a cornerstone that we should be slamming into people's heads, and we're not really doing it. And it's crazy to me.
And I'll openly admit, after doing the research on vitamin D and fiber, I'm definitely going to change how I practice. These are things that are going to be at the forefront of my mind in making specific recommendations. I am excited to get into more of these kinds of discussions with you because I do feel that as a whole, being an MD, I have not been taught a lot of these supplements that are the safest things out there for us and the benefits of them. And maybe we can treat or help with chronic disease or avoid chronic disease if these things are put at the forefront.
Absolutely. And I mean, this is the kind of stuff that we weren't really taught in pharmacy school. It was breezed over. This has kind of been knowledge we've gathered as we go along. But if this can affect the way that you practice medicine and your patients can feel better and have better outcomes, like this is pretty fantastic.
It makes you beg the question, did they assume that we were going to know this information? Like, it's just we should automatically know this information, meaning automatically everybody in the U.S. population should know this information? Or do they intentionally leave this out of the curriculum? It's very weird.
I mean, like, they tell people to eat healthy and stuff, but, like, I think that people are struggling in specific areas, and things like this can, we have an obesity epidemic. And we have these GLP-1s, we have these fantastic treatments, and we have, surgeons that do bariatric surgery, and we have all kinds of stuff that we do need that is very important. But simple things like this, literally just eating healthy, eating fruits and vegetables, and eating things that we're supposed to eat, that we've really evolved eating, is really all you need to do. You just need to eat enough of these things to where you're not starving at night when you're sitting in front of the TV going, man, I could really go for some chips or a piece of cake. Like, you might look down, man, I only got 30 grams of protein. I'm going to cut up some carrots and an apple, and I'm going to have that. And now you have your snack, you hit your fiber goal. And I know it's not easy. Not everybody's perfect. But again, it goes back to that, don't let perfect be the enemy of good enough. Like, just make some sort of change. Promise yourself 5 nights a week I'm going to get 30 grams of fiber, and then see how it goes.
I think that sounds like a great start. I really do. I really do. Do you have anything else for us, Anthony, for today?
I do actually. I have a couple little things I wanted to highlight. One thing is, because we talked a little bit about this, I kind of got back in my retail pharmacist attitude, which I haven't been in a while. And one recommendation that I never get to make anymore that's really cool is there's a product called lanolin. Lanolin's made out of sheep's wool. It comes as a cream. Now, lanolin is mainly used for like a nipple cream for breastfeeding women. They can get cracked nipples. It's very painful. It's safe to use with the baby. But a lot of people don't know that if you have cracked skin, if you get dry hands, dry feet, and your skin cracks and it's really painful, lanolin is like a magic ointment. The moment it touches that crack, the pain is gone. It like hydrates the area. It is like, it's unbelievable. And I have a tube of lanolin at home because I get it once in a while. I get cracked skin and everything. And I never get to make that recommendation to people because I don't work in retail pharmacy. But I've had like people that cut hair, and a lot of times they get irritation from the clippers, and they've used lanolin, and it is I can only describe it as magic, because when you put it on, the moment it touches your skin, that pain is gone, and it's incredible. Now I will say, no antibacterial properties or anything like that. So if you have a wound, I wouldn't be slathering it up with lanolin. You do need to still use your Neosporin, whatever, but for these specific, winter time's coming here. We're in Ohio. People's skin's going to dry out. It is so awesome.
And we've all been there where, you're cutting your fingernails and you have to cut them a little bit extra too short because you got that freaking crack in your skin that always keeps opening up, by the way.
Yeah.
Never ever heals. Drives me absolutely insane.
Telling you, man, once you try it, it's going to be a cornerstone of your recommendations. That's really all that I got here. I was really excited to discuss all this. I think that it's something that we as healthcare professionals need to do more of, to not only treat people better, but to gain trust. And you and I aren't responsible for the mistrust that's out there, and I think we both understand that. But I think we have a duty to do what we can to try to build that up again. And making people physically feel better by giving them these recommendations and watching it in front of your eyes, I think is really the first step in kind of rebuilding some of that trust, at least locally in the community, and then we can go from there.
I am very excited about implementing these two different changes into my practice, and I'm also very excited about learning about the different types of supplements, because once again, we did not learn some of these in medical school, and I'm interested in learning about the physiology so I can better understand how complex these things truly are in the body and how important they are to the body. So with that, thank you everybody for listening. Don't forget to link and subscribe. Share the episode with a friend or colleague. Please leave us a review on Apple and Spotify. It helps us find others. And then please follow us on social media. Please tune into our next episode. We're going to be talking about the patenting quiet war over the human genome. We're going to be reviewing how we're moving from a world that involves prescribing medication to owning biology itself, like we talked about in our previous episode with Palantir, and what we're doing with the human DNA available to be studied. Thank you, everybody, and have a wonderful day.
Looking forward to getting into it with you guys. We'll see you later.
Take care. I'm Dr. Joseph Miladore. This is Guardia Di Medicina. We are the guardians of medicine. My goal is to expose corruption, amplify the signal of love, and honor the sacred. This content is brought to you by Youngstown Guardia LLC. All rights reserved. Any reproduction, redistribution, or unauthorized use of this material without written consent is strictly prohibited.
I'm Anthony Fossaceca, PharmD. My mission is to uncover the realities of medicine and bring about discussion of the important issues that are currently flying under the radar. In a time where people are so divided, I want to find common ground and identify true problems rather than being distracted by emotional divides.